Have you ever wondered how painkillers work in your body? The answer lies within a fascinating class of drugs known as opioids. Opioids are a type of medication that can relieve pain. They work by binding to specific proteins called opioid receptors, found on nerve cells in the brain, spinal cord, and other organs. This action blocks the body's perception of pain, providing relief to those in distress. Opioids can be derived from the poppy plant or created synthetically in a lab. They are a critical tool in medicine, helping manage severe pain that might be unresponsive to other treatments. However, they must be used responsibly due to their potential for addiction and other serious side effects. Despite these risks, the role opioids play in healthcare is invaluable. They've revolutionized pain management and have allowed countless patients to live more comfortably. Now, let's delve deeper into the world of opioids and understand their mechanisms. So, what are opioid agonists? Well, to understand opioid agonists, let's first break down the term. Opioid refers to a broad class of drugs that include both naturally occurring substances like morphine and synthetic ones such as fentanyl. Agonist, on the other hand, is a term used in pharmacology to describe a substance that triggers a response when it binds to a receptor. So, an opioid agonist is a drug that binds to opioid receptors in the brain and other parts of the body, triggering a response. This response typically involves a reduction in the perception of pain, along with a sense of euphoria, or a feeling of intense happiness or well-being. That's why opioid agonists are often used in medicine to manage severe pain. Now, how do these opioid agonists work? Well, they work by mimicking the effects of naturally occurring pain-relieving chemicals in the body. These chemicals, known as endorphins, interact with the opioid receptors to reduce the perception of pain. Opioid agonists, like morphine and codeine, do the same thing. They bind to these receptors, triggering a response that can help to manage pain. Let's take a closer look at morphine, one of the most well-known opioid agonists. Morphine is derived from the opium poppy and has been used for centuries to treat severe pain. When morphine enters the body, it binds to the opioid receptors, much like the body's own endorphins. This binding triggers a series of events that ultimately leads to a reduction in the perception of pain. Codeine, another common opioid agonist, works in a similar way. However, codeine is less potent than morphine, and is often used to manage less severe types of pain. Codeine is also frequently combined with other medications like acetaminophen to enhance its pain-relieving effects. But it's not all about pain relief. Opioid agonists also have other effects on the body. For example, they can cause drowsiness, mental confusion, nausea, constipation, and with long-term use, can lead to physical dependence and addiction. That's why it's so important that these drugs are used under the careful supervision of a healthcare professional. In addition, opioid agonists can also depress the respiratory system, slowing breathing and potentially leading to life-threatening situations. This is particularly true in cases of overdose or when opioid agonists are combined with other substances that depress the central nervous system, such as alcohol or sedatives. Opioid agonists are powerful tools in pain management, but they're just one side of the coin. Understanding their effects, both good and bad, is crucial in ensuring they are used safely and effectively. As we continue our journey into the world of opioids, we will explore the other side of this coin, opioid antagonists. Stay tuned. Now let's turn our attention to opioid antagonists. These fascinating substances work in direct opposition to opioid agonists, and understanding their function is key to appreciating the full scope of opioid pharmacology. So, what exactly are opioid antagonists? Simply put, these are drugs that block the effects of opioids. They achieve this by binding to the same receptors in the brain as opioids, but instead of activating these receptors, they block them, hence the term antagonists. Think of opioid receptors as locks and opioids as keys. While opioid agonists are keys that unlock these receptors, triggering a cascade of effects in the body, opioid antagonists are like decoy keys. They fit into the locks, but they don't turn. Instead, they prevent other keys, the opioid agonists, from unlocking the receptors. This mechanism of action makes opioid antagonists incredibly useful in a variety of medical contexts. Perhaps their most well-known use is in reversing opioid overdose. In an overdose situation, an antagonist like naloxone can be administered to quickly block the effects of the opioid, effectively turning off the harmful effects and potentially saving a life. Naloxone, which you might know by the brand name Narcan, is a prime example of an opioid antagonist. It's often carried by first responders and even friends or family members of individuals who use opioids due to its powerful ability to reverse the dangerous effects of an overdose. Beyond overdose reversal, opioid antagonists also have a role to play in managing opioid addiction. Drugs like naltrexone can be used as part of a comprehensive treatment plan for opioid dependence. By blocking the effects of opioids, these drugs can help individuals reduce their use and manage cravings, serving as a vital tool in the journey towards recovery. Despite their benefits, it's important to remember that opioid antagonists are not without their risks. By abruptly blocking the effects of opioids, these drugs can precipitate withdrawal symptoms in individuals who are dependent on opioids. This can lead to discomfort and even severe symptoms, highlighting the need for careful use and professional supervision when using these drugs. It's also worth noting that while opioid antagonists can block the effects of opioids, they don't affect the underlying issues that may lead to opioid use in the first place. That's why they are most effective when used as part of a comprehensive treatment approach, encompassing not just medication, but also therapy, support, and other interventions. In conclusion, opioid antagonists serve as a powerful counterbalance to the effects of opioids. They can prevent overdoses, aid in addiction treatment, and offer a fascinating glimpse into the complex world of opioid pharmacology. As we can see, opioid antagonists play a crucial role in preventing overdoses and managing addiction. But what happens when opioid agonists and antagonists interact in the body, you might wonder? Well, let's dive into the fascinating world of pharmacology to find out. Picture a battlefield, where the agonists and antagonists are the opposing forces. The agonists, remember, are like the keys that unlock the opioid receptors, producing effects such as pain relief and euphoria. The antagonists, on the other hand, are like the guards that block the receptors, preventing the keys from unlocking them. Now, when an agonist and an antagonist meet at the same receptor, a tug-of-war ensues. The antagonist, being the guard, tries to keep the receptor locked, while the agonist, the key, tries to unlock it. The one with the stronger affinity for the receptor, the one that binds tighter, usually wins this tug-of-war. But it's not just about strength, it's also about numbers. If there are more agonists than antagonists, the agonists may dominate, unlocking more receptors and producing their effects. Conversely, if there are more antagonists, they can successfully block the receptors, preventing the agonists from producing their effects. Now, what happens when an opioid agonist is already bound to a receptor, and an antagonist comes along? Well, the antagonist can displace the agonist, taking over the receptor and blocking it. This can abruptly reverse the effects of the agonist, which can be both beneficial and potentially dangerous. In a medical setting, this interaction can be used strategically. For instance, in cases of opioid overdose, where too many agonists have bound to the receptors, causing harmful effects, an antagonist can be introduced. The antagonist can displace the agonists, reversing the overdose effects. This can literally be a lifesaver. However, this displacement can also precipitate withdrawal symptoms in someone who is opioid dependent. Imagine the body has gotten used to the presence of opioid agonists. Suddenly, the agonists are displaced by antagonists, and their effects are abruptly reversed. This can shock the body, triggering withdrawal symptoms. So, while the interaction between opioid agonists and antagonists can be used beneficially, it must be managed carefully. It's a delicate balancing act, ensuring that the right amount of agonists and antagonists are at play to achieve the desired effects without causing harm. In summary, the interaction between opioid agonists and antagonists is like a dance. Sometimes they work in harmony, each playing their part. At other times they are in conflict, each trying to outdo the other, but always, they are interacting, influencing each other's effects, and shaping the overall opioid response in the body. So, the interaction between opioid agonists and antagonists is a delicate balance. And understanding this balance is key to using opioids safely and effectively in medicine. How do these opioids make a difference in the field of medicine? Well, let's delve into this. Opioid agonists and antagonists play a vital role in several medical contexts, from pain management to anesthesia and addiction treatment. Let's start with opioid agonists. These substances stimulate the opioid receptors in the brain to alleviate pain. They are the go-to medication for managing moderate to severe pain, especially in patients suffering from chronic conditions such as cancer. The relief provided by opioid agonists is not just physical. It also allows patients to maintain a better quality of life, to sleep better, and to participate more fully in their daily activities. Now, let's move on to opioid antagonists. These substances are quite the opposite of their agonist counterparts. They block the opioid receptors in the brain, preventing the body from responding to opioids. This blocking effect is critical in the field of anesthesia. Opioid antagonists can reverse the effects of opioids, bringing patients out of the sedative state induced by opioid agonists. This makes them a valuable tool in the anesthesiologist's toolkit. But the medical uses of opioid antagonists go beyond the operating room. They also play a crucial role in addiction treatment. Opioid addiction is a serious issue worldwide, with thousands of people struggling to break free from the chains of dependency. Opioid antagonists help by blocking the euphoric effects of opioids, making them less appealing to the user, and aiding in the recovery process. So you see, opioid agonists and antagonists are two sides of the same coin. They work in opposite ways, but together they help alleviate pain, ensure safe anesthesia, and fight against opioid addiction. They are not without their risks, as we'll discuss in the next scene, but when used responsibly, they can make a world of difference. Indeed, opioids have a significant impact on many aspects of medicine. However, opioids are not without risks. With their powerful abilities to relieve pain and induce feelings of euphoria, opioids can also lead to a number of serious health concerns, such as dependency and overdose. Firstly, let's discuss the potential side effects that can occur even after short-term use of opioids. These may include constipation, nausea, dizziness, and sedation. But of more concern is the risk of respiratory depression, which is a potentially fatal slowing of breathing that can occur with opioid use. This is especially concerning as the dosage increases. Another significant risk is the development of opioid use disorder. This is a chronic disease that can cause major health, social, and economic problems. It's characterized by a strong desire to use opioids, difficulties in controlling its use, persistent use despite harmful consequences, and a higher priority given to drug use than to other activities and obligations. Opioid use disorder often leads to tolerance, where the body requires higher doses of the drug to achieve the same effect. This can easily lead to an overdose, which can be fatal if not treated immediately. So, how can we mitigate these risks? The key is responsible use. Opioids should only be used under the supervision of a healthcare professional, who can monitor for signs of misuse and manage the dosage to prevent overdose. It's also important to understand that opioids are not the only solution for pain management. Non-opioid medications, physical therapy, and certain behavioral treatments can also be effective alternatives. Another crucial precaution is the safe storage and disposal of opioids. These drugs should be kept out of reach of children and should never be shared with others. Unused opioids should be disposed of properly to prevent misuse. Finally, it's vital to be open with your healthcare provider about your medical history and any other medications you're taking. This can help avoid dangerous drug interactions and ensure the safest possible use of opioids. Remember, while opioids can be beneficial, they must be used responsibly. It's up to us to balance the benefits of these powerful drugs with the potential risks, ensuring the best possible outcomes for patients. So, what have we learned about opioid agonists and antagonists? We've delved deep into the world of opioids, unpacking the intricate dynamics of agonists and antagonists. We've seen how opioid agonists, like morphine and codeine, bind to opioid receptors in the brain, mimicking the effects of naturally occurring pain-reducing chemicals. We've also explored opioid antagonists, such as naloxone, which block these receptors and reverse the effects of agonists. The interaction between these two groups is a fascinating dance that plays out in the human body, influencing pain perception and our response to it. In the realm of medicine, this knowledge is indispensable. Opioids, when used correctly, can be powerful tools in pain management, yet they are not without their risks. We must always exercise caution, understanding the potential for dependency and the importance of responsible use. With this knowledge, you're now better equipped to understand the fascinating world of opioid pharmacology.